Sometimes I get the question about what the difference between a frenectomy and a release is. A frenectomy is just generally if you go in and cut the tissue, of course, lip tie, buccal ties or cheek ties, tongue tie. If you take a laser and you just cut, the most classic reason why we do frenectomies is if you have a tight muscle that's pulling too hard on the gum, that can cause gum recession. In fact, that's probably the number one reason why frenectomies are done in dentistry, is to get the pressure off the gum so you don't get recession. Now, when it comes to release, we're talking about tethered oral tissues. If you have lip muscles, cheek muscles, if the tongue is too tightly attached so that that's restricting the actual function of the muscle, the goal of the quote-unquote release, incidentally, a release is a form of a frenectomy. But the catch is you have to get in there, you have to cut enough of the tight fascia that's connecting the muscle to the bone so that now the muscle is actually free to move. That's why they call it a release. A release is you're releasing the tethered part of the fascia that's causing the muscle to not be able to move around properly. So typically when it comes to a release, you're going to have to cut a lot more of the tie. There's going to be a lot more involved. And then you have to get in there and kind of pull things around, make sure that it's loose and that the muscle is actually free to move. So it's a little bit more complicated with the release.